I'm going to show you how to use our Accuchek machines. These are how we test patients' blood sugars. These machines are found on the docking stations, and they need to return to these docking stations when not in use. The docking stations are what charge the devices. There are two parts to using this device. The first is a set of controls that we have to run, and then the second is a patient test that we will perform. So to do a set of controls, I'm going to take the device out of the docking station, and I'm going to turn it on by pressing the button down at the bottom. And then I'm going to get an alert that quality checks are due immediately. So this machine will not let me do a patient test until the quality controls have been done. Quality controls are done every 24 hours on these devices. So I need to type in my operator ID. That is my employee number. So I can either manually type it in, or I can scan it in with the barcode that I received at orientation. Some people say that the barcode is best just because it prevents typing in the incorrect numbers. To use the barcode, you're going to click the barcode scanning button up here, and then you'll just scan your barcode, and it will log you in.
One thing to note is that while you're logged in, all actions performed on the device are associated with your name and flow over to our charting system in your name, so do not loan the device out to anyone while you're logged in.
So to do a set of controls, I'm going to click Control Test, and I'm going to walk you through the different pieces of equipment that we have here. So I have my control solutions. My low is level 1, and my high is level 2, and then I also have my testing strips. These control solutions have expiration dates written on them. So this expires in 2023, this expires in 2023, but these solutions also have expiration dates sooner than that if they're opened. So once this control solution is open, it's only good for 3 months after opening. So if I'm the one who opens up one of these control solutions, I'm going to date them with the date that they were opened and also the date that they expire, so 3 months from today's date. These testing strips, they expire on the date written on the bottle itself. These do not have that 3-month window as well. So when I'm on the control test screen, it asks me to either test my level 1 or level 2, or what I can do is I can click this barcode button, and then I can scan one of my solutions, and it will detect which one I just scanned. So I'm going to go ahead and click the barcode. I'm going to scan my level 1, and then it's instructing me to scan my strip lots. So I'm going to go ahead and grab my strip bottle, press the barcode button, and scan them. And now it's going to instruct me to put my strip into the machine. So these strips are kept in these protective bottles. We don't want to leave the lids open because these strips can go bad if the lid is left open. These strips are only good for about 2 to 3 minutes after being removed from the bottle, so please keep that in mind. And as you can see, the strip has this little yellow window right here. That's where I'm going to apply my blood sample. And I have arrows over here with this little kind of microchip side here. The arrows go into the machine, so I'm going to place it in like this. I need to wait for the machine to be ready to take my control solution sample. So once I have this screen open, I can apply my solution. You only need a very, very, very small amount of solution onto that strip. So what I'm going to do is I'm just going to make a little bit of a bleb, and it goes right on the front of it. So I don't come from the top, I just go from the side, and just a little bit is all I need. And then I should get a pass. So that means that the low control has passed. So then I can take the strip out and I discard of it, and then I can click this green check mark to go to my next level. If the quality controls are not due, or just doing them to practice, or they're not overdue, you might have to go back to the control test screen to get to here, but I'm going to go ahead and click on level 2, or I can just click the barcode. If I click level 2, it will have me click this barcode to scan my level 2 solution. And then I'm going to scan my strip lots. And it's giving me that message to insert my strips. So again, I have this yellow window. That's where I apply my sample. The microchip thing is going to go down into the solution, into the device. And then I'm going to wait for the screen to be ready for me to apply my solution. So then again, I just need a little bit of a bleb. I'm going to go from the side here. I'm not going to come from the top. From the side, just a little bubble of solution, and then I'm all done. So now this has passed, so I can take my strip out and press the check mark. And now I can run a patient test. If I turn this machine off, and then if I turn it back on, you can see that it's going to say that these control tests are not due for another 23 hours. QC due in 23 hours.
If you're running a set of controls and they fail, follow these troubleshooting steps. First, try again. Sometimes it's just a fluke. If it still fails after that, check your expiration dates and make sure none of your solutions are expired. And if they fail after that, contact the lab and they manage the maintenance of these devices. You should also know that to maintain certification and use of this device, you do have to run a set of controls every year. This is usually done at your yearly skill validations, but if you are unable to log into your device, contact your educator and they can help you get certified again. Now we'll go over the steps behind performing a patient test with our Accuchek device. You will need to gather your supplies. This includes a lancet to poke your patient's finger, an alcohol prep pad to clean their finger, a pair of gloves, your glucometer test strips. You will be scanning your patient's wristband, and you will need a small piece of gauze or a cotton ball to wipe away the first drop of blood.
Now I'm going to show you how to run a patient test. So I take it off of the dock. I'm going to turn it on. And it's going to have me log in again. So I'll click this play button. And I'll scan my operator ID. Now I'm going to click patient test. And then after that, I click glucose test. It's going to have me scan my patient's ID. So I'm going to scan their wristband. And then their name should pop up, but this is a test patient, so it doesn't. And then I'm going to scan my strips. And I'll be putting my strips into the machine. Once I have the ready to go on my device, I will have my patient's finger ready. So what I will do is I will clean their finger with alcohol pad. You need to let the alcohol dry. If you don't let it dry and you poke them too soon after, you could contaminate the blood sample and it will not be an accurate reading. So usually you have to wait at least 30 seconds, sometimes a minute for this to actually dry. And then you will poke your patient with the lancet. Then we will have our first drop of blood on their finger. And what we do is we wipe away that first drop of blood with something dry, like a piece of gauze or a cotton ball. So I'm going to wipe this away. And then we need to test that second drop of blood. So to test their blood, it's best to keep this device as flat as possible, and you bring it up to the side of their finger and you just let the blood flow into the meter. And then you will get your reading. You can check it off, and this will flow into our charting system automatically. You do not have to manually chart our blood sugars. You should still write them down because there are sometimes glitches in the system and the blood sugars don't always flow over to the chart.
Once you're done with the device, you just turn it off to log out. You will need to pass a validation in order to use this device, and part of the validation includes knowing the following values. This device can detect a blood sugar between 10 and 600. Any value less or more than that will display a out of range alert on the screen. The critical values for an adult patient who is older than 29 days old is less than or equal to 55 or greater than or equal to 401. The critical values for an infant less than 29 days old are 29 and greater than or equal to 201. If you do get a critical value as a result of your patient's blood sugar, you will have to put a comment on the results screen that pops up. And we initiate our hypoglycemic protocol at 70. So any sugar less than 70 has a protocol in place to correct that sugar before it reaches a critical value. Some other facts that you need to know is that we disinfect the glucometer between each patient using the hospital improved disinfectant. Once we disinfect it, we can put it back on the docking station once it is dry. If we place it while it's still wet, we can damage the docking station and the device itself. This device lives on the docking station. This is how it charges. It's very important that we keep the device charged. Always keep the device flat when you're using it and avoid getting any sort of fluid into that port opening. If you get fluid into there, it will damage the device. And as always, discard any open, unlabeled products because we do not know if they are expired or not, if they are not labeled.